order.
This conference will now be recorded.
And a new member. Welcome, Kevin.
Thank you.
You want to say anything about yourself?
Well, certainly happy to be here. Grown up here in Harwich since I was 5. My roots are here on the Cape. My great grandfather used to be a lighthouse keeper at Highland Light in Truro, so my roots are firmly planted here, and I've lived right here in town since I was 5 years old. And when the opportunity came up, I was really excited to get the chance to be a part of it. And certainly, there's a lot that I'm gonna learn along the way. I certainly don't know everything that it entails at this point, but I've been reading my minutes from last week, and I'm excited to be a part of it.
Well, welcome.
Thank you.
I guess I have to read that pursuant to Governor Baker's.
Yes, just so you all are aware, this meeting is not being broadcast live. It's being recorded, and we will repost it tomorrow. We couldn't live broadcast 2 meetings at one time, and the selectmen are meeting at this moment as well.
Oh, okay. So I don't need to read that?
You still need to read it.
Oh,
Yep, we just aren't live, so people can't call in.
pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, Chapter A, Paragraph 20, the Governor's March 15, 2020 order imposes strict limitations to the number of people that may gather in one place. This meeting of the Harwich Board of Health is being conducted via remote participation. No in-person attendance of members of the public shall be permitted, but will make every effort to ensure that the public can adequately access the proceedings as provided for in the order.
Great.
I now call the meeting to order. And everybody is present except Sharon, excused absence. And did everybody have a chance to read the minutes of the previous meeting?
Yes.
Any changes? Everything okay with it?
Mm-hmm.
Do I hear a
Yes.
motion to pass the minutes?
I'll make a motion to accept the minutes.
Okay, Ron, Matt, do you second it?
Yeah.
Okay, and I agree, so motion passed. I should tell you, Kevin, that I have to name everybody because we're not in public to see who's agreeing or disagreeing, so when your turn is up, I'll say your name. Okay, Megan, all yours.
All right. Just so you know, I may have to. Oh, go ahead, Jen.
So I need you guys to do a roll call vote on approving the minutes, please.
Oh, I thought I did. No. Okay. I didn't include Kevin because he wasn't a member then. Okay.
So what you have to do is you have to say Matt Antone, and he'll say yay or nay. You'll say Ron, he'll say yay or
Oh,
nay.
I'm sorry. Okay. Okay. All right.
All right.
Ron, do you
Yes.
approve? And Matt, do you approve the minutes? And I approve the minutes. So
Yeah.
minutes have passed. Is that okay? Okay. All right. Now, Megan.
Okay, sorry. Just so you know, if I end abruptly, I just have to pop over to the Board of Selectmen's meeting, and then I'll be back. But right now, in front of you for your work session is a continued review of the draft Town of Harwich Nutrient and Pesticide Control Bylaw. This has been continued from May 19th, 2020. What you have in your packet is the last draft that I had provided you, and there was discussion at that point to either completely rewrite them or look at doing more of an education rather than a bylaw with fines. So at this point, it's really an open discussion amongst the board members, and maybe you can figure out if you want to have a smaller subcommittee work on this throughout the month, or if you decide that you already know what you want to do, you can talk about that. Just a little background for Kevin. The Board of Selectmen adopted the Comprehensive Wastewater Management Plan back in 2012, and part of that was to include a nutrient management, a fertilizer management piece to town laws or education. So surrounding towns like Chatham and Brewster, Orleans, they have adopted a policy or bylaw that is similar to the one that's in the packet. Other towns have done something a little more strict with needing education and licensure of anyone that's going to apply fertilizer. So I guess I'll just leave it at that, and if you have any questions, I'm here, Katie's here, and Jen's here to answer them for you.
Everybody get a chance to read them over?
Yes.
Comments?
Looks good to me.
Okay. Any additions? Do you think we should be doing any more?
I don't think so.
And again, I know I'm the new guy here, so I don't know
Well, that's
quite
okay.
where our what our limitations are and what our expectations are as far as management of it. As I was reading through the bylaws of it, the one thing I did notice is that it really only applies to town-owned land. There's no education at all, even for anybody that's on private property. They can just do whatever. Is that my understanding?
Good question.
That is for the pesticides. Yes,
Okay.
pesticides is just town-owned land. There is a law that prohibits states and towns to impose further laws on private property as in regards to pesticides. So even if we wanted to, we couldn't require any restrictions on private property for fertilizer, for pesticides. But the fertilizer point is for both public and private.
Okay.
Any other questions?
Now, if we're looking at fertilizer in the private sector, I mean, I'm sure town organizations that are using fertilizers regularly are reporting what they are using and applying the code. And I don't know how any of that's connected yet. Again, but is there any way, if fertilizer does apply to both town-owned land and privately owned property, is there any way? I mean, what's the process of checking on that? I mean, I happen to live pretty close to the West End Reservoir. I know we had a giant green algae bloom, just last year, largely due to a lot of these things. And is there any way that we're actually checking on what kind of fertilizers are being used privately?
I don't think so. I think Chatham has said that anybody who is distributing fertilizer should take a course, like get certified, take a course. I think it's at the community center, Megan said. And that's something we might want to think about, that anyone who's fertilizing private property needs to have this quote-unquote certificate. And that might be something that we
I think I would like to see some kind of at least education. I understand how difficult it would be to really monitor what people are using privately, but I think it's pretty safe to assume there's a really giant portion of the population who really has no idea what goes into their fertilizers and what it causes. And I think at least some level of education, even something that they have to log into and watch online, a packet that goes with it, something just so that people are aware. I think bringing that awareness forward, even if it's people are still going to use what they want, but I feel like if we educate along the way, I think people will make smarter decisions, and hopefully decisions that are more environmentally friendly.
Jen, do we have any literature in the, not that anybody goes there now, but.
I don't know that we have anything, and Katie might be able to shed some better light on it. I don't know if we have anything specific to Harwich, but Katie might know.
Not as of right now. Conservation Commission might. I know there's been talks within their commission on creating legislation around the ponds, at least, of how much fertilizer people use. I know in our nitrogen sensitive areas, we do have some regulation, but in terms of education, that's something that we can certainly work on. I don't know necessarily how we could enforce the education on that. I understand your point, but it would be tough enforcement, at least on our end, to create something where someone would have to go through an educational piece before they could use it. All of the licensed landscapers already go through it, so it's more the homeowners that it would be tough to force an education. We can certainly develop something that would be available and put that out there. That's something we could definitely work on if that's what you guys would like us to do.
Well, maybe the whole point would be to put out a statement what the town uses and why, and what commercial people use and why, so that people have an idea what the town is using right now, and then they can go by that suggestion.
Yep, we could definitely work on something like that. I don't know. A few months ago, I think before actually COVID started, Sean Fernandez came in and discussed what the golf course uses. So maybe we could partner with him. It's probably more property specific, but we could certainly create some kind of broad educational piece for people.
At least people would have an idea.
Some type of literature, yeah.
Yeah,
Mhm.
yeah.
I mean, that would be great. As I'm looking, I mean, I agree with everything that's here. I'd like to expand on it a little bit with some education. So, I mean, as it looks, it's great as long as it's open to, further expansion down the road. That would be great.
And that's something too that you guys can develop if you want to develop a subcommittee and to help develop that literature. That would be, an easy suggestion for you guys too, and we can work on it on our web. We can post it on our website. So totally up to what you would like, at the board's discretion.
Okay. I would like to have the input of Sharon. She likes to read a lot on things that come as on discussion. So maybe can we put on an agenda for the next meeting with Sharon to see about a subcommittee? And I want her present to discuss that. Can we do that?
Sure, that sounds good.
All right. I think that's a good start. There's no way we can monitor it because we can't go up to people's homes and ask them what they're putting on their lawn.
No, I don't think you can. I don't think you can monitor it. But I think if you can put a statement on what the town is using and the reason it's using a certain amount, it gives people an idea what they should be using around their houses. especially when they're around water areas.
Yeah, that's a good idea. Does that sound like a good start, Kevin?
Absolutely. I feel like anything would help. You know, yeah, being someone who's lived here for so long, you'd like to think that people are generally going to take an interest in their town, and I think if the information is out there, sure, it's not going to catch everybody, but if we get some, it's a start and it's an improvement, and the more it's out there, the more that people are aware of it. So I would certainly just like to have that level of education out there, and at least have it readily available for those people that are going to listen.
Okay. So we'll continue that on the next meeting. I have a cat that's very jumpy tonight. I'm sorry. So should we go to you, Katie? I mean, I don't know. Should we go to, oh, Megan, you're back. Good.
Yeah, I just did my COVID update. I've got one more thing later on, but I should be available for a while. What have I missed?
Well, we're going to wait till Sharon for the next meeting and maybe develop a subcommittee for education for the public.
Good, great idea. All right,
Okay.
so the next thing on your agenda is a discussion on the sewer connection application. So we need a vote to approve the use of the sewer connection application that's in your packet. And if you remember, the Board of Selectmen and previous town administrator had really pushed for a $0 fee on sewer connections, and the Board of Health approved that. So there's no fee for sewer connection applications for those permits. The permit application is very basic, just almost exactly like our existing septic system connection application. And it just needs your vote. And then after that, we can discuss extension requests.
Okay.
How many people have, let's say, connected right now?
None.
None.
We're still putting the pipes in the ground in the main
Okay.
streets. And we're a little bit above, we're good on the schedule. We weren't supposed to be done until September of next year, and now it's looking like we may be finished with the infrastructure in March. So all of the pipes in the ground should be complete in March, and as long as the Chatham side is ready to receive the Harwich flow, we could be ordering connections as soon as March.
March of 2021.
Yes.
Oh, okay. So, you want an approval of what's written down for the sewer connections?
Just of the permit, the application permit.
The application, okay. Do I hear a motion from somebody to
I'll make
approve?
a motion. I'll make a motion that we approve the application.
I'll second it.
Approves it. Matt seconds it. So I'll do a roll call. Ron, you're in approval, correct?
Yes.
And Matt, you approve?
Yep.
And Kevin, do you approve?
I approve the permit. Yep.
Okay, and I approve, so the motion's passed.
Great. So now on the work session is to talk about what your parameters may be for approving or denying requests from homeowners to extend the time period to connect. The sewer regulations require 1 year from the date of the order to connect. So once a homeowner receives an order to connect, which can be as early as March of next year, the order comes from the Board of Health, and that order allows for 1 year to get the permits and installers in line and do the construction and have it completed within that 1 year. And when we last talked about this, I feel like it was forever ago, we talked about wanting to have a mechanism to allow for extensions of that 1 year time frame. And things to think about when you discuss extensions is how old the existing septic system is there a financial hardship, is there a special circumstance, and mostly how old the system is. Most people are calling us saying, my system's only 3 years old. Am I going to have to abandon it and connect to the sewer even though my system's only a few years old? So I think I would recommend anything less than 10 years old, you approve an extension up to the age that that system is 10 years old. And then beyond that, it's really a discussion amongst you guys to figure out how long you want to give people to connect. And then the other part is, do you want to include the option of applying for an extension for a financial hardship? And know that there are very low interest loans available through Barnstable County Septic Program. Some of those loans allow for no payments until closing on a house if it's for sale, and some loans allow for a lien on the house that you don't pay until the house, until the owner of the house passes away, if that's the case. Or there's a lot of financial options for people to pay for a sewer connection, and it's not just completely out of pocket.
Do we have all that information in a, I can't remember the packets that were sent out. Is all that?
No, that information's not in the packet because it's really a discussion that you guys should have. And again, without Sharon here, I don't know if you're comfortable making these recommendations, but
how long should a septic system last?
The old tale was that it would last 20 to 30 years. We've seen cesspools that were installed in the 40s that still operate, but the useful life of a system is 20 to 30 years.
This is something I would like to have Sharon involved with too. If everybody's okay, maybe we can do some research during the month. I know we had gone over what Chatham has, but there didn't seem to be too much of a problem with them, with the connection, correct?
So Chatham's policy is if you have an alternative technology system, you're able to extend, I believe you're able to allow that system to be in place for 10 years. And then there's a matrix of, if it's 6 years, you can have it 4 years. So, but it only applies to the alternative technologies that are out there. And in Harwich, the only alternative technology systems in place in the sewer district that we have going right now are commercial buildings, the 400 Plaza, the physical therapy office, and maybe 1 or 2 others, but they're not just residential homeowners that have them. They all have traditional Title V's.
Okay. So we,
What would it cost for to connect to the sewer system? What's the
the
normal cost?
The last numbers I had heard were anywhere between $7,000 and $12,000. That includes the design.
had that gone up at all since way back when we first discussed it?
I haven't gotten any updates. I can find that information out from Chatham.
Just curious.
Mm.
Matt, any questions?
No, not really.
Kevin?
What does it cost to put a new system in if you weren't connecting to the sewer?
About the same.
About the same
A
thing?
little bit higher, yeah. So it would be
I
like
am kind of up to speed. What I read through didn't have a lot of it.
Say that again?
Who's
Getting
talking?
I think Kevin's talking, but there's a
Oh.
delay.
Okay.
No,
Um,
I had started to, and then I heard people talking over.
Okay. Hmm.
Kevin, do you have a
What-
comment?
what-
Let Kevin to speak.
I just as far as the connection to the sewer, and again, I am kind of coming up a little bit to speed with what I had, read, what was in the packet available to me. So the sewer connection is a mandatory requirement within 10 years of having the sewer active. Is that my understanding, or?
Not exactly. Connection to the sewer is mandatory 1 year after you're ordered. So regardless of how old your system is, if the sewer line's passing by your house, the Board of Health is going to order you to connect within 1 year. If your system is less than 10 years old, that's where this discussion's kind of coming about, whether or not the board will automatically approve extensions or not for systems that are younger than 10 years.
Okay, so systems 10 years and older, if you're in the sewer line, it is a mandatory connection once you are given the order.
Yes, it's mandatory for everybody unless you request an extension.
Is there a yearly cost?
So once you're connected to a sewer, you'll get a sewer bill just like you get a water bill. It's based on flow.
Yeah. Okay.
Do we know what?
What's the usual
average-
cost of something like that?
Again, last year's projections were in the $200 to $300 a year for a 3-bedroom home. Similar
Okay,
to,
so
a little higher than your water bill.
So it's minimal.
Depends on your definition of minimal, I suppose, but yes.
Well, for a residential house.
Okay. So, any other comments?
I just guess that the $7,000 to $10,000 expected connection fee. I know you've already stated that there's a lot of avenues for people to get help with that. I know plenty of people that would have a tough time coming up with $7,000 to $10,000 on short notice. So that would be the major concern. As long as there are avenues that people are being required to hook up to it. Like you said, there are septic systems that were done in the 40s that are still active. As if those people are being required to, even if it's the 10 years and they have a second that still works, I could see a lot of people grumbling about that, and I wouldn't blame them.
Yeah, that's been yeah. The work sessions in the very beginning, that was a big comment from a lot of people, a lot of retirees, and yeah. I don't have an answer for that.
Yeah, I mean, I do like to hear that there's a lot of other avenues available if it is going to be mandatory, but it's, I would certainly, just knowing from my interaction with the public working as a nurse, I'm sure we haven't heard the last of that. I'm sure when it comes time to actually tell people they need to connect, you're going to hear a lot of individual grumbling on it. And I just think as a town, we should be prepared for that and have an answer for it.
You're right. And I feel
Well,
that. Go on.
As long as there's avenues of, in other words, if there's financial hardships or there's other avenues of finance, I mean, what's the point of putting the whole point of putting the sewer in if we don't start have people connect? You know, everybody in the world's going to have an excuse if it costs money. But you know, the town is going through the whole point of doing this stuff, obviously for good reasons. So we have to figure out, you know, how to help people connect, but you can't just say, okay, I don't want to do it. And so, you know, because it's a financial burden, you know, especially if their systems are failing.
Well, I think it's time to go to the new business, right? At 7? Or can we go on? I don't know what you want to do.
Go ahead.
We
That's
could
fine.
continue this after.
We can certainly move on. As long as we're helping people when they need it.
We can come back to it. I just didn't know if
No, that's fine. Go ahead.
7 p.m.
Just so you know, the applicant for the 7 o'clock is not joining us, so there's no need to wait. There's no need to jump off and back. So
Okay.
you can
Okay.
continue.
Perfect. Well, it's going to be a hardship for a lot of people, and I think we have to, I feel like all the information we got when we first started this is old now, costs and things, and so get some information on loans and things like that and let you know what they are next month.
How many people from Chatham have hooked up right now?
Last I knew, it was that over half of the town is connected, and they're going for 100%. So
What's their feedback been?
that it's expensive.
How much pushback has there been?
They haven't moved into the enforcement phase as much as they had hoped. So they're sort of passively enforcing it, sending a letter here and there. And just recently, I believe they started bringing people to the Board of Health for show cause hearings for not connecting and starting to enforce some fines. It's been tough. From what I've heard from Judy over in Chatham, she's the health director there. They have the people that hook up right away, and then they have the people that don't. So it's been tough on the Board of Health to track them, but hopefully we have a good system. Knowing their problems, we can foresee how to fix that for us, anyways.
That's the point. That's the point I'm trying to make, is that maybe you know, in other words, if Chatham's already invented the wheel, maybe we should figure out what they have done, and you know, and find out what the resistance was, and what the resistance is. In other words, you know, how many people were really into hardship. How many people just didn't want to do it because it costs money?
Yeah, if you could find out about the Chatham, I'll find out about the loans and stuff, Megan.
Yeah, that'd
Sure,
be great.
I can find out about how many people have connected and if they have a new projection on costs for connection.
Yeah, that'll give us more ammunition to work with.
Sure.
Okay. We'll continue this in the next month also, I guess. Okay. What do you want to do?
We can just move through the agenda. I think we can do the next item and then talk about the last that the plumbing variance. We can do that after we talk about the definition of a bedroom.
Yes, go ahead.
Okay, so item C on the work session is definition of a bedroom discussion. Right now, we have a current definition in our regulations that state the definition of a bedroom shall mean any portion of the dwelling which is so designed as to furnish the minimum isolation and privacy necessary for use as a sleeping area, and includes but is not limited to bedroom, den, study, sewing room, enclosed heated porch or family room, but does not include bathroom, kitchen, dining room, halls, unfinished cellar, open deck, garage, unheated porch, or living room. This definition is very ambiguous and unclear to builders and homeowners when they are designing floor plans for their homes or doing additions or renovations. The definition of a bedroom has been, in the past, I think, a little loose in order to capture those rooms that maybe say den but are actually bedrooms. It allows the Board of Health or the Health Department to call rooms bedrooms when builders or homeowners don't call them bedrooms, even though in the future they may be used that way. Throughout the last 6 months to a year or so, we've gotten to know the builders and the homeowners that are doing these renovations and have found that they have a really hard time with this gray area that we have in our definition. It's more of an opinion than it is a fact, and we need a clear and concise definition so builders and engineers can design something without having to second guess themselves and say, well, maybe the Harwich Board of Health would call this a bedroom, but we're only going to use it this way or that way. So Katie has done some research on surrounding towns and sanitary code, environmental code, and what they define bedrooms as. So in your packet, there's a suggested Harwich Board of Health definition. There's the state sanitary code Title V definition, and then there's Barnstable, Bourne, and Eastham's definitions, which there were more than those, but these three give you three separate looks into how different towns identify what a bedroom is. And just so you're up to speed, it's important because septic systems are based on the number of bedrooms in the home. And it makes a difference when you're in a zone 2, which is a water recharge area where you're limited to the number of bedrooms that you're able to have. We've seen a lot of houses that can only have 2 bedrooms based on the number of square feet of the lot, but the house itself has 12 rooms, and there's 2 bedrooms plus a sewing room and a dining room and a fitness room and all of these separate rooms. So being able to have a clear definition of, yes, of course that room is labeled den, but you have all of the minimum, you have all of the requirements that we look for to call it a bedroom. So, or to disqualify it as a bedroom, whether it has a 5-foot or a 6-foot opening, that can take away a bedroom if someone is looking to reduce bedrooms. So we wanted you to look over these suggestions and definitions and have an idea of how you feel about it.
Thank you, Katie, for doing this. Eastham has quite a statement.
I will say that looking at the suggested bedroom definition for Harwich, I like the fact that it's all objective. There's nothing that there's no ambiguous, oh, we're calling this. Here's the definition and it's based on numbers. You can't argue that and say it's X, Y, and Z if it's A and B in this case. So I wholeheartedly approve. I'm a math guy anyway, so I like the fact that it is defined there using the numbers and not what somebody's calling it.
Yeah. Any other comments? I think it looks great.
I think the old one's definitely dated because it just kind of uses language to define what a bedroom is. And language is up to interpretation, really. So the suggested one is a lot better.
What do you want us to do, Sharon? Make a motion to accept it? I mean, Sharon, there I go. Megan.
Okay. Yes, that would
Yes,
be
it was
great.
tonight.
And this is a policy, not a regulation, so we don't need to have this advertised in the newspaper or have a public hearing about it. We can just, you can vote on the new definition and then we can publish it.
Okay.
But you do need to vote.
Do I hear a recommendation to accept the bedroom definition for Harwich?
I'll make a motion to
Matt,
accept
make a
the
motion.
suggested Harwich Board of Health bedroom definition.
Okay. Second?
I'll second
Second that motion.
it. Let Matt do it.
Okay. We'll have Kevin be the second. Okay.
Yes.
So roll call. Ron, you're in agreement?
Yes.
And Matt, you're in agreement?
Yep.
And Kevin, you're in agreement?
Yes.
And I am in agreement, so the definition is passed to make it a policy. Thank you, that was good work.
Nice
Katie.
job, Katie.
Yeah,
All right,
Thank you. I'm sure all
last,
the builders will be happy.
you can't get around it.
One that too, I'm sure they will.
all right, so the next item on your agenda is an application to apply, I'm sorry. An owner is requesting that the Board of Health review an application to the State Plumbing Board for a variance from the State Plumbing Code. The variance request is to use an existing 1.5-inch drain where a 2-inch drain is required. And an update on this application, the owner has already bypassed the Board of Health and gone straight to the Plumbing Board and on September 6th. And the Plumbing Board has already levied a decision to grant that variance. So it's really a moot point for you guys to vote on it. So you could open the hearing and just vote to withdraw the application, or Jen, would they withdraw it, or would they just dismiss it?
I think they can just decide as a group to take no action. I don't think that they have to take a vote. Yeah.
Okay.
You don't have to take a vote?
Just take no action. Okay, perfect.
Yeah, I think you guys can just decide to take no action. No vote is required.
That's good.
If everybody in agreement with that?
Yes.
Okay.
Yes.
All right. So
Glad we
no,
have you, Jen. Okay, so 2 more things on your agenda is my report and then permits. I'll start with my report. August was a pretty good month for COVID. We had a couple straight weeks where we did not see any new cases. And an update for today, the positive people that were associated with the outbreak in Chatham have recovered and are out of isolation. And we did gain one new case today. So we have one active case in Harwich at the moment. And that active case is related to a long-term care or assisted living facility. So we at least have an idea of where the infection came from. In August, Monomoy Regional School District held a COVID antibody test clinic for their staff, and they did invite some of the Harwich staff, the police and fire and health and town nurse, to participate in that. They were able to test, I think it was 257 people, with only one person who showed positive for antibodies. And just to remind people, the antibody test is a rapid test, and it'll show if you have a past infection and not an active infection. So it's not used for diagnostics for an active infection. I have been in contact with the school nurses of all 4 schools, the Tech, the Lighthouse Charter School, and both the high school and elementary school, about COVID response and planning. And it's definitely going to be a learning year for the school nurses who never had to do epidemiology before. It's going to be tough. One school nurse has contacted me probably 3 or 4 times a week just for questions. It's not something they're used to doing, and it's confusing. So we have a good open relationship where they can call us, we can call them if there's an issue with a case that we've discovered that has a connection to the school. So it's we're going to work it out, but it's definitely going to be learning for the next month or so. We had a little bit of a lesser amount of COVID complaints this month in August. I think people got used to the wearing of the masks. But we still continue to get complaints on a daily basis for businesses, mostly businesses not playing by the COVID rules. And we continue to follow up with those, as well as the county inspector. We hired a part-time health inspector who started on August 31st. Her name is Jermaine Leonard. She goes by Jerry. She's been working for a couple weeks now, and she replaced Mark Pacelli for 19 hours a week. She's going to do our food service program. So we're in the middle of training her to make sure she's comfortable doing that, and we're comfortable with her doing that. We're happy to have another staff member to take the burden off of us, which is long overdue. We've started planning for flu clinics. So in addition to COVID, we're dealing with flu. And we have scheduled the employee flu clinic for October 7th, and that does extend to board members. So we'll send you out an invitation for that. It is going to be a drive-through this year, which is new to everyone. Still at the community center. We'll have you stay in your car. There'll be a pre-registration piece to it where people will have to pre-register and have their forms filled out to make it go faster. We'll have 4 to 6 nurses available, and we'll be able to get probably 150 people or so through in a few hours, which is pretty good for our first drive-through. If that goes well, we will look into doing a public clinic that is open to town residents and school kids. They're really pushing the drive-through options this year because of COVID. We don't want to have people entering buildings where they don't need to be and crowding buildings. And then I just wanted to let the public know, and you know, that Barnstable County is doing a drive-through flu clinic, and unfortunately it's the same day as our annual town meeting on September 26th. But it does open at 8 a.m. and it's open to all residents across the Cape. pre-registration is required. And if you go to the county's website, you can click on a link to register for your shot, and that's open to people of all ages. You do not have to have insurance, or there's no copay, and it's free and open to anybody. And it should go fast enough that if you get there at 8, you can still make it back for a town meeting. Yeah, that's what I have for monthly update.
Megan, I did, and board members, I sent out that email to you all today about the flu clinic registration. So if you don't see it or want me to resend it, let me know, but I did send it late this afternoon.
Great, thank you. And then we'll do permits unless anyone has any questions about the monthly report or COVID.
The flu clinic registration, and I check my work email more regularly, which is why so I check it in the mornings. I would have not have yet gotten that email, and I apologize if this was in there. Do you need another nurse, or do you have enough? Is that I know how to give an immunization? So if we need any extra help, I'm available.
Okay, I will connect you with Sue Giselle, our town nurse, and have you talk to her about volunteering. That would be wonderful. We'll always take your help.
I've spoken to Sue with my work, so
okay. You got her on speed dial, sure.
Notice I'm keeping my mouth quiet.
You got a lot on your plate, Pam. So then the last thing on your agenda is to approve permits, and we have only one. It is a Title V inspector permit for Thomas Rue. He is a renewal. So we just need you to make a motion to approve the permits.
Hear a motion to approve the permits?
Make a motion to approve it.
I'm sorry, I didn't catch who said that.
Who made that motion?
It was Matt.
Okay,
Matt. Second.
okay, Matt approved it, Ron seconded it. Okay, Kevin, are you in agreement to have the permits pass? And Matt, you're in agreement?
Yes.
And Ron, you're in agreement?
Yes.
And I'm in agreement, so passed.
Okay. All right, well, I mean, you've got the meeting to discuss anything if you have it. Otherwise, you are able to adjourn.
I have one question, Megan. Do we follow the people who had, in other words, do we follow the people who recovered from the COVID at all, or how does that work?
We don't follow them at the health department level. Their information is in the state system. So once they've recovered from isolation, I can see that they're still in the system, but I don't follow them for further follow-up. But of course, they're doing a lot of research on long-term effects of COVID. So
yes, that's my point.
These people are in a database. So if they come up with other issues, they are already in a database.
Okay, so somebody's following up someplace, do you think, or?
Eventually, I think the state is still in the beginning stages of COVID, so they're still trying to keep up with contact tracing of current positives. Okay. But I know in the future, should someone go to the hospital with a new heart issue, they'll look back at their history and see that they once had COVID.
Yeah, okay.
Okay. Anything else? Do I hear a motion to adjourn?
I'll make a motion to adjourn.
Do I hear a second? Okay, so Ron, you're in agreement?
Yes.
And Matt's in agreement?
Yes.
And Kevin's in agreement? And I'm in agreement. So, end of meeting. Thank you. Thank you, Katie, for your work on that. Made it nice and neat. Okay, and Megan, I
Thank
just
you
want
all.
to tell you that I can't be at the town meeting because that's my weekend to work.
Okay,
Okay.
all right. I'll be there.
Okay. Good night, everybody.
Good night.
Good night.